So the study design was again double-blinded, randomized, active dummy design. It involved multi-center location, including international, and a patient would receive either 6 or 8 cycles of CHOP or Adcetrix plus CHP. So vincristine was eliminated. Vincristine or BV were blinded, so neither patient or investigators or pharmacists did know knew which who's getting what, and the inclusion criteria were adult patients 18 and above with good performance status with a CD30 expressing PTCL. The study was designed that 75% of the study population had to had ALCL, either ALK positive or ALK negative. The rationale for that was some regulatory requirements from European countries, and 25% were PTCL not otherwise specified or angioimmunoblastic T-cell lymphoma. Some of the rare entities were not represented, such as ATLL or ANKL in this study. And the autologous stem cell transplantation as a consolidation was allowed, or radiation therapy as consolidation was allowed, and it was not considered to be an event if it was pre-planned by the investigator as a consolidation as opposed to a treatment for progressive disease. And the trial showed significant difference, statistically significant difference between experimental arm versus CHOP arm. So what's important in this study is that it showed not only statistically significant and clinically significant improvement in PFS, as reported at 2 years. However, it also showed improvement in overall survival, which has never been reported at this point. And consolidation with autologous stem cell transplantation, which happened in about 20, on average 20% of the patient, a little bit more in a CHP arm than CHOP arm, but on average was 22% in ACHP and 17% of the patient in CHOP arm. There was no significant difference between the patients who did get transplant or not, and the benefit was shown in that in a patient who got stem cell transplant arm as well. The benefit was across the gender, age, subtype of lymphomas. Obviously, the biggest benefit was for the patient with ALCL histology, but benefit was also observed in PTCL histology as well.